Please
Okay.
welcome Jean Rodriguez to Caregiving Cafe, and thank you for educating us on Medicare in plain English today.
Okay.
Feel free to tell us more about what you do, and then we are ready to listen and to learn.
Okay. So, hi, everybody. My name is Jean Rodriguez. I live here in Buda, Texas, just south of Austin. And basically, what I always like to introduce myself as is that I don't work for insurance. I am an advisor. I'm an agent to where I enroll, and it could be any plan that suits your value, your needs. Today, we're going to go over some basics so that you can understand. I'm going to share my screen because you do have some options. There's some pitfalls that you have to be aware of. And like Lynn was saying that, you know, she had a lot of information going her way that she wished she had a little bit more guidance. And that's what I do. Let me go ahead and see if I can share my screen real quick. Let's see. I did this once and okay, so share content. Bear with me.
Yes. We're all such high-tech people over here in this group. So
That's the last thing I am is high-tech. Okay.
There you are.
Okay. So do you all see the screen understanding your Medicare choices?
yes.
Okay. So this is going to be basics. Like I said, you have two parts of Medicare. You have your original Medicare, Part A and Part B, hospital and medical. Part B is your medical. That's what you're paying $170 a month right now. The great news is for 2023, because of the Inflation Reduction Act, it's going down to $164 and I believe 52 cents. So it doesn't sound like a lot, but when you talk about there is millions of seniors that are on Medicare, it's a big deal. They had a surplus from this year. They found that they're going to have a surplus because they thought more drugs for Alzheimer's were going to come on the market, and evidently they didn't. So they're giving that surplus back to our seniors. You have another boost coming in your Social Security, like Lynn was saying. We have some great news. It's going to be 8.5 or 8.7%. So it's going to come out to anywhere from $139 to $142 extra. The reason for that, again, because high cost of food, utilities. We're looking at another increased cost of utilities for the winter. So all these things play a factor, and that's the reason why they did an adjustment, because they just saw it increasing, especially with the threat of recession coming on. So I'm glad to see these changes. The other change that's happening is prescription costs. A lot of Medicare Advantages are going to zero copay for tier 1 and tier 2. That is awesome. Usually it's just tier 1 of your drugs, and tier 2. I know this might be a little Chinese to you guys as far as the tiers, but every drug is on a tier level. You have tier 1, tier 2, tier 3, all the way up to tier 6. Tier 2 usually is about $5 to $10 to $15. Well, a lot of companies now with the subsidies are taking that down to zero copay. Great news. So this is a little dated on this. You can see it's for 2022. The deductible is $1,408. That has gone up. The one thing that I like to talk about is if you have the right to stay with original Medicare only. Okay. You have two different options that you can enroll after you get your original Medicare. And for those of you that are just turning 65, you have 3 months after your birthday month to get Medicare. Otherwise, you will get a penalty. They do have penalties. The other penalty is if you get original Medicare and you do not get a prescription drug plan, you will get a penalty. It doesn't matter if you don't have prescriptions or not. You have to get a prescription drug plan to avoid that penalty. Those are the biggest pitfalls or loopholes that I've come across with our seniors. I came across an 80-year-old just the other day, a rancher, healthy as a horse. And he says, well, I'm going to get on this Medicare Advantage now. And when I did that, he had a huge penalty coming at him because he never got it. He didn't understand. And I said, you have to get a prescription, even though you don't have prescriptions. You have to get a plan. So there are options to get out of that with extra help through Social Security if you qualify. So let's go with a step 2 here. Before I move on, does everybody understand about Part A and Part B, that there's deductibles to that? Medicare Advantage does take care of those deductibles. But the one thing about Medicare is that there is no maximum out of pocket. It continues and continues and continues. That's why you have to have a supplemental plan to help you with that. It only covers 80% of your medical bills. 20% is left on you. So what do we do with that 20%? We go to option 1 or option 2. Can you guys see this step 2?
Yes.
Yes.
Okay. So before I move on from there, does anybody have any questions about the Part A and B and what we just went over? I want to make sure I take this step by step with y'all.
Mhm. I believe Part A, there, we don't pay for that, right? That is, we just get
You're
that.
entitled to it,
We
right? You're
only-
entitled
we
to it.
only pay for Part B.
Only Part B, the 170. Yes, ma'am.
Okay.
That's correct. But Part A does have, I think it's $14.88 now, deductible, and that only lasts for 60 days. So that's what I mean about maximum out of pockets. They don't stop with original Medicare. If you go in the, God forbid, you go in the hospital, you only have original Medicare, you have to pay that $14.88. You go back in the hospital 3 months later, you have that $14.88 again. It does not stop. It renews itself every 60 days. Your Part B has a deductible of $233. That renews all the time. So that's what I mean about maximum out-of-pocket costs, to where there is no limit with original Medicare. So that's why you want to make sure you have a supplemental. Okay, any other questions? Nope. Okay, let's go to step 2. Okay, so there's 2 different options that you have with original Medicare. You can get a supplemental insurance, which is those letter plans, Plan F, Plan G, Plan N, but those cost per month. You have to pay for those. They do not come with a prescription drug plan. So you have to get a Part D prescription drug plan. So you're paying for your health insurance, your Medicare, and also your prescription drug plan. There's advantages and disadvantages to that. The disadvantage is you're going to be paying out of pocket premiums per month, and they go up over the course of time. They don't stay fixed. The advantages is that you have no network. You can go to any doctor you want in the United States that takes Medicare. If you travel, that's what I recommend. If you are concerned about networks and you have the funds to pay for something like that, then that's a good option for you also. The other option that you have is you can have original Medicare, the Part A and B, and you can have just Part D, your prescription drug plan. Okay, you're allowed to have that. You do not have to cover the 20% medical with a supplemental. You can have your original Medicare and a Part D prescription drug plan. Okay. Just remember, original Medicare only covers 80% of your medical costs. So you will be responsible for the 20%. Option 2. Option 2 is where you hear a lot about. It's called Medicare Advantage. It's another term in Medicare. It's called Part C. A lot of people get confused with Medicare Advantage and Part C. They're both the same. It's just a different term. So Part C combines A, B, and D all in one card. So it includes your prescription, so you don't need to pay for a prescription drug plan. It includes your A and B medical, and many of the plans come with a 0 premium. It just depends on your area, what's available, and your choices. So a lot of them have 0 premium. So what you're only paying for it when you use it. For instance, you go to a primary doctor, it's 0 copay. For your wellness visit, 0 copay. However, if you go to a specialist, it can range from $30 to $50. If you go in hospital care, you have copays, co-insurances. The advantage is it has a maximum out-of-pocket limit. Some of them are $3,900, some of them are $2,900, some of them are $6,500 or $7,000. But rest assured, you have a maximum out-of-pocket limit. Because remember what I said about original Medicare, it does not have a limit. You keep on paying and paying. So that's the advantage of a Medicare Advantage. So it just depends on your situation, your finances, and also your value of what you find that's most important to you. Let's go into before we move on, anybody have any questions about the two options?
So I've heard different things. I've heard people say that Medicare Advantage plan is the worst possible way to go, and you're sold, basically that all this great stuff, but it's really not good, and you should always stick with regular Medicare. What are your thoughts on that, and why do people say that?
They say that because, especially with dentists they don't want to take Medicare. They don't want to take plans. So you have challenges with networks. That's why I say you can either pay. You only have a couple of options. I do not, in my opinion, keeping with original Medicare, you have a lot of risk there as far as out of pockets. So Medicare Advantages does have its challenges. There is no perfect insurance. There is no perfect insurance. I'll be the first to tell you that. But I've seen Medicare Advantage save thousands of dollars to people that are using it. You have to work the network, and that's what I do. I make sure that your primary, your specialist, and we review your prescriptions to give you a better view of what you're looking at, an estimated cost. Because again, being that Medicare only covers 80% and you're left with 20%, that bill could be very, very high. Option one, again, people like those options, but you got to realize those plans can cost $150 to $300 a month, plus your $170 that you have to pay for Medicare. Let's not forget that. You always have to pay for Medicare. So yes, you do have a great point that they are challenges to that. But as far as the majority, that's why I'm so excited about Hayes and Travis, because they're coming in with a lot of benefits now, because it goes by your demographics. It goes by county and zip code. Like I've always got the argument, people moving from Dallas County or from Bexar County, San Antonio area, coming here, and they just get so disappointed saying, you guys don't have any benefits whatsoever like we do. Well, it's because your demographics. 2023 is a game changer. Every major company is upping the game, which that's why it's exciting to see what's going to happen. Is there challenges? Yeah, of course there is. Part C or Medicare Advantage, you're going to have to work the network. And that's the thing that I always say, get somebody that is local or that you can call on to answer these questions on a daily, monthly basis. Because again, with my clients, they're always calling me about, hey, I need a dentist. I'll look in the network. Customer service numbers are always going to be tough. Some companies, they have it farmed out to the Philippines, and it's tough to even get over the language barrier. But I have a quick story on that. I was talking to I was conferencing in the customer service with the client, because I can only go so far, and they say we need to talk to the client, we can't talk to you. And I conferencing them in, and as we're trying to figure it out, I hear a rooster crowing, and I said, sir, I didn't know you could have chickens and roosters in Austin. And he goes, Gene, I thought that was you. He goes, that's not me. And the little girl, or the woman on the line, says, that's me. I'm over here in the Philippines at my house, and we have roosters, chickens, and goats. And I go, oh, okay. So that answers that question, that a lot of them farm it out to the Philippines. Any other questions? Okay, so we're going to go into the enrollment periods. Okay, so basically we just went over option one, option two of what you can do with original Medicare.
Okay,
All
Jean,
right.
I'm sorry, we
I'm
have,
sorry.
yeah, just introduce yourself for everybody
Oh.
to see. Just sorry for the
I'm
brief
sorry.
interruption, but that's okay.
Tim Jorgensen.
Yeah,
And you were talking about the Advantage plan and everything. And what
There you
I,
go.
what I had I've come across, and I'm at UT, they're trying to switch us into an Advantage plan at the UT Austin. But with some of my other friends, like I had someone who broke her hip, and there's always this caveat, like on regular Medicare, you could go like in between a hospital, like an inpatient rehab, and then like skilled nursing or a rehab at lower, and then at home, and then, outpatient. And I noticed there's a little caveat in mine, there's a little asterisk, and it says, we have the right to choose a lower cost therapy or facility. And they get you, that's the only thing, the care is that they kind of get you on that little clause, because I don't know of anybody that's got a care plan. I only know about 2 or 3, but they got moved directly into like a nursing home. They could not get into a skilled, a inpatient, what do you call it? Rehab hospital that they needed. And, yeah, you can appeal, but it's only through them. You can't appeal through like the original Medicare. You can't appeal through Medicare and have a third party intercede. I just want to bring that up. I'm at a quandary too, because I'm kind of getting forced into a care plan. And I've seen a
Are
couple
you,
things.
so you're with the university?
Yeah, UT Austin.
Okay, so you have choices. You can either go TRS care or ERS. Is that correct?
No, well, at the University of Texas, they're self-insured. So they only have what's called UT Select. And I think I can do that. It's buried, but between November 1st and the 15th, I can do that. Just go back. It acts like a supplement.
Yes, and I don't know, are they paying for that because of your years of service, or
Yeah.
do you have to pay for that?
No, well, it was my wife's years of service, so I am paying for it. I got a spousal for a while, but it's going up, and I'm at a quandary.
So you're a dependent. You're dependent on her
I was a
insurance.
spousal. Yeah, I'm spouse.
So she's paying, basically, her plan is charging for you as a dependent.
Yeah, and it was a pretty good rate until, she passed away.
What's a pretty good rate to you? What's a pretty good rate? What do you mean by a pretty good rate? What's a pretty good rate?
Well, at the time it was about $350, and
A month?
that included a Delta Dental like superior, like a plus that covered like crowns and implants, and even
So $350 or $315 per
plus the
month,
Medicare, plus my Medicare. You're right. I have to
plus
pay
the
for Medicare.
170. Okay.
But what's nice about this one, and it happened to her because she was disabled. And what happened was, you get a full dental, and, your pharmacy's included, and you get a vision. But what happened to her was I had to get her into a facility that didn't take Medicare. It was called there used to be a Health Corps out in Dripping. And what happened was, I love this one because the UT Select stepped in as primary. They paid like 65% with a large deductible and but they stepped in. And there's a clause in there that even if it does take Medicare, you get a reduce, but they'll step in. So it gives you
That's what Medicare Advantage. That's what Medicare Advantage is that it sets up where when you get a Medicare Advantage plan, you no longer need to present your Medicare card. This becomes your primary, your Medicare Advantage private insurance, because they handle the claims, and nothing will be approved unless it's Medicare medically necessary. Let's make sure we understand that. It's not Medicare Advantage that's denying you. It's Medicare saying, is this medically necessary? Because if Medicare doesn't accept it, your private insurance will not accept it either. So there are challenges on that as far as skilled nursing facilities. But again, that's the insurance. If you just stay with original Medicare on a private insurance or a skilled nursing facility at 20%, that's thousands of dollars out of pocket.
Mhm.
So
No, I was going to say if we can continue with the
Yeah, I'm
talk
sorry.
and then come back. No,
I
no,
know.
that's okay. That's okay. But
Yeah.
let you.
You know, when they ask this question.
Yeah, no,
that's
and
the
it's
second
all
thing.
pertinent.
It's
but
pretty.
We'll go back
Okay.
to it with at the Q&A. Yeah.
Yeah,
Okay.
I'm
thank
sorry.
you. No,
I
that's
apologize,
fine.
everyone.
Okay,
No,
not a
that's
problem. So let's go on to eligibility and enrollment because this is important. First thing is that as far as when you're turning 65, they give you 7 months, 3 months before your birthday month and 3 months after your birthday month. That's what I was talking about, the penalty. So if you know somebody that's turned 65 and they still haven't done anything to make a choice on their Medicare, you need to let them know they do have deadlines to avoid a penalty. And the 7 months is 3 months before their birthday month and 3 months after. Now we're getting right into annual enrollment, which starts October 15th to December 7th. It cuts off on Pearl Harbor Day, but not to worry. If you miss that annual enrollment and you have a Medicare Advantage plan that you just want to change out of, you do have special enrollments throughout the year. This is not advertised, but it is printed. It's open enrollment, January 1st through March 31st. Medicare a couple of years ago understood that everybody signing up in October, November, December, they understand you got to kick the tires to the plan. So when people started complaining that, hey, I got on this plan, I'm stuck for a year now, and it's horrible. It's a lot of money. I've noticed that some of my doctors don't take it because the agent or themselves didn't do the due diligence to check to make sure they're all in network. So Medicare, a couple of years or so, changed to where now you have an open enrollment, January 1st to March 31st. You can only change one time before March 31st to another plan so that you're not stuck with that plan throughout the whole year. So it behooves you to get your appointments set. Let's keep that in mind. Soon as we're getting close to January, get your wellness visit, get your doctor's visits in order so that you can see how the plan's going to treat you. You do have that special enrollment period. There's certain circumstances. For instance, if you're retiring and losing your employer coverage, you have throughout the whole year a special enrollment period. You move out of a service plans area, like say, for instance, you move from San Antonio to here and it's not annual enrollment, don't worry. You have a special enrollment period. If you have extra help through Social Security, extra help only helps with prescription costs, okay, and the penalty costs. If you qualify, you have to make less than $1,700 a month to qualify for that. If you've been diagnosed with certain qualifying chronic conditions like diabetes, cardiovascular, you have a special enrollment period. The reason why I like to talk about these special enrollment periods is because people get so nervous that they miss December 7th. And then I've come across other people that are in shock that now I'm stuck with this plan because it's April. Well, I review all of these different special enrollment periods, special circumstances to see if we have an opportunity to upgrade your plan or to change it. Okay. So the advantages of Medicare Advantage plan, there is a high member satisfaction. It has been documented. It has been across the nation. The satisfaction is up. That's the reason why you're seeing more plans come out in Medicare Advantage than ever before, because people are utilizing them to the extent of the benefits, all the little bells and whistles. But let's make sure we understand, what is your prescription copays? What is your doctor's taking? Your specialist taking? Make sure they're all in network. Your hospital stays, those are going up. Medicare Advantage helps with that maximum out of pocket coverage. So where you're not getting hit all the time. Preventative services like flu shots and vaccines, those are going to be covered. Your prescription drugs, it's included, which original Medicare does not include. You would have to get that separate. Your vision, your hearing, those are all not included in original Medicare. They do include in Medicare Advantage. A lot of employer insurances do not have dental, vision, or hearing. You have to buy a separate plan for that. And like I said, the biggest point is limits on your annual out-of-pocket costs. There is no protection with original Medicare. It will keep on charging you throughout the year. Medicare Advantage has a cap. So does Medicare supplements. They have a deductible cap. But again, you're paying for those month after month along with your Medicare. So there's pros and cons to every approach that you can look at. It just depends on your circumstance and what you find to be value. Everybody's unique, just like the gentleman was just saying what he was going through. I've gone through so many different scenarios, and I always want the best for my clients. I either will show them, we move on to a different plan, or you stay with what you got, but at least you looked at different options to make that choice of, hey, I feel comfortable having what I got, even though it's not that great. But again, being that, oh, can you guys see me?
I don't know.
There you go. Okay. Okay, so being that Medicare is always evolving. Okay, you're there? Okay. So
Yeah.
being that Medicare is always evolving, this is the caveat that I always say, as your health changes throughout the years, so should your insurance, okay? Because insurances change every year. You guys should have gotten this in the mail already. It's called your annual notice of change. Your annual notice of change, the private insurance company is obligated to tell you what changes are coming to your plan. Now, this is the caveat. Every insurance company will come out with a new plan that gives better benefits, but they won't change your plan. They won't upgrade you. They will leave your plan. I've met people that have been on their same plan for 5 years, and I come across it and I said, you can stay with the same company. There's an upgrade on the plan that you're missing all these benefits that you didn't even realize. And they always tell me, well, why wasn't I switched to that anyway? They don't do that. They only change your plan with the little upgrades, but a whole new plan with more benefits, they won't switch you to that. Any questions so far? Yes, ma'am.
Excuse me. Yeah, I don't see your screen anymore. I just see you.
Yes, ma'am. I'm already, yeah, did you want the screen back up? Did you have a question?
No, I just thought we were supposed to be seeing the screen. I'm sorry.
Oh, no. This is where
I
we're
meant
coming
your
across the question
meant your-
answers. I mean, it's a short presentation.
Oh, okay. I didn't know. Okay.
I try to keep it very simple. We're not going to go into details of it because I want to keep it very simple, very basic. Now, each individual has different situations that we should talk on a one-on-one because again, for privacy, and another is information that I tell one person, another person will say, oh, that's for me, and it's not. So that's why I always say, it's best on a one-on-one conversation.
Mhm.
Does
Yeah,
anybody else have any
I
questions?
encourage, if there are any questions specific to your situation as opposed to general, that would be a really good idea to speak privately with Jean. But if there are any other questions, I do have a question, but I wanted to let anybody else who might want to discuss anything else. Go ahead.
Lynn, you're going to give us Jean's information for being able to call him and stuff?
Yes, please. And if
Yeah, I don't know if you can you see this? I don't know.
Yeah, okay. Is it possible to put it in? I have it and I will send it out on my email, okay? Otherwise.
Yeah, because I don't have anybody's email, but I
Yeah,
can certainly give you
I
mine.
will, and I don't share them without permission either. So what
Yes,
I will do is I will send your contact information to everybody on my mailing list, and then you please contact Jean, even if it's just to make sure that you have the right plan. Like you said, Jean, things change, especially in
Yes, ma'am.
caregiving. Every year is different than the last year because of the conditions of our loved ones. And you might need different requirements. You might have different requirements or even medications or, life happens, right? So it
Yes.
would be really good to do that. So I did have one thing I got in the mail a couple days ago from, we have basic, that's worked really well for us, basic Medicare, for my husband, I should say. And he has Part D, that's also worked well for us, and that's all we have. I got a letter saying that our plan has changed from PDP or from Plus, Medicare Part D Plus, I think it was, to Value, Medicare Value. And it says that it will save over the course of the year about $700, which is nice. But now I have gone from zero deductible to $500 deductible.
So
And
that sounds like the individual insurance company. So when you're saying that, is that WellCare then? It sounds like a WellCare plan value, maybe?
yeah, I don't know. I just saw
So-
that we started with original, and basically, as long as it's working for me, I don't really look at the details or the name.
Okay,
It's
so
working
first,
for us. So, but this $500 copay, when it's zero right now, but our month is gonna go down. He pays like $154 per month because he has a ton of meds. To is going to go down to, I don't remember what, but it's considerably less. So, but anyway, any thoughts on that? And they're doing it. They
150,
didn't say if you-
154. Okay, so 154 on a prescription drug plan is extremely high. I
It
don't know
is,
if we have
it is,
a,
but my
Yeah.
husband takes 35 pills every day, 4 patches, eye drops. He has a ton of meds and very expensive meds.
okay, so so just to be clear, it has nothing to do with Medicare. This is a prescription drug plan.
Right,
Your deductible at 500 has nothing to do with Medicare. It's you have a separate prescription drug plan. Okay,
yes,
so they do change, like they cancel out a plan and they will replace it with another plan. So
Okay.
basically, it sounds like that they're just discontinuing a plan and putting them on another plan. Now, is that plan right for them? We need to do an audit. Now, let me give this because you could do this on your own also. And I like to share this information. It's a great website from Medicare. It's medicare.gov.
Oh, Medicare.
Medicare.gov.
mm-hmm.
It's a great resource that I use also. You make an account in there. You can put your husband's drugs in there, and it will spit out a list of all the prescription drug plans in your area with the lowest premium and the lowest out-of-pocket costs of drugs. And you might be surprised of what you come across.
Mm-hmm.
That's exactly what I use as far as
Yeah.
my quoting. That's what I use for everybody.
That's what I did, and I almost pulled my hair out because of so many meds. Yeah, I did all of that. I'm very
Yeah.
proud of myself because
Yes,
I had to
ma'am.
figure that out all by myself. Okay.
There you go.
That's where were you 14 years ago? But so anyway, but yeah, it is definitely a great thing. Now, hopefully you only have a handful of meds. That's great. But when you have as many as my husband does, and to me, it got very confusing. And that's when I said, even if your copay, your deductible, you need to look at the end of year costs, because when you hit the catastrophic stage tier, which he does halfway through the year, we are so excited to get to that point, because what used to cost $100 or $300 now might cost $50. You
That's
know,
a great point. I can go
yeah,
over
it
the
is.
donut hole.
That's why it's very important if you take a lot of meds. Many people, what I kept reading was, you don't want to get to the donut hole. And I'm saying, what do you mean? Of course you do, because after you go through the donut hole, you get to the catastrophic, which is everything is practically a giveaway, you know, but it's very expensive at the beginning. So there are so many points to look at instead of just the pretty numbers that you see at the beginning. And that's why I was saying, have all your meds together. Like you said, put them in the Medicare.gov. And it's just a lot of stuff. And close your ears, Jean. What I did is I gave the rep that I called 3 of them. I gave them the list of meds and they figured out things for me because, I'm the client, hello, and I call that customer service.
So let me just hit on that because you
Yeah.
brought up some really good points, and I just want to clarify that to make it as understandable as possible, because a lot of people are confused about the catastrophic, the donut hole, and that's not going away, unfortunately. So talking about prescriptions, your husband is a great case to look at, because I found sometimes Medicare Advantage plans have better coverage than PDP plans. Keep that in mind. And there's no cost per month to have it. I come across individuals that have a Medicare Advantage plan just because they have a lot of prescriptions. And if they get a PDP plan, they're paying a lot. But with the Medicare Advantage plan, all inclusive with the prescription plan also, you get more coverage. Does it work? I don't know. We put them all in there to see which one is best as far as out-of-pocket concerns. Now, talking about the catastrophic and the donut hole, a lot of people get a little bit confused, and it's very simple. It does not go by what you're paying. It goes by the retail cost of the drug. So this year it's $4,660, I believe. Whenever I tell people that, because I like to inform them about, hey, you have a really high name brand drug here. This is what's going to happen throughout the year. And they don't understand. I will never get to that point, Gene, of paying $4,600 for this drug. Yes, you will. Because that drug, let's just take Trulicity. Trulicity is about a $600 to $700 retail drug. Your Medicare Advantage plan, the copay is $47 until you reach $4,660. When you reach that point, it shoots up to 25% coinsurance. So you'll be paying around $200 or so. So to understand that, the first 4 or 5 months, like Lynn was saying, the first 4 or 5 months, you're going to be paying $47. And then you get hit with that $200+ for about 3 months out of the year. When you reach $7,550, then it goes down to 5%, which is going to be way lower than what you're paying at $200+. So that's where I recommend, and I hope there's no doctors on here, but I'm going to say it anyway. This is what I recommend to my clients. Doctors have samples. When you get to that point to where you're starting to hit the donut hole, hit your doctor and say, do you have a sample? I need samples. They know the game. They understand. They bug drug reps for samples because of this reason, to help their clients, to help their patients get through 2 or 3 months of costs, of high costs. So when you're using the samples, and by the time you get to the past the donut hole, you're going to be in a better situation. Now, do they always have samples? No. So I always say, sometimes they give you a month's worth of samples. Sometimes they give you half a month of samples, but at least it helps you get past that donut hole a little bit better. But just remember, it doesn't go by what you're paying. It goes by the retail cost of the drug. That's where there's a big misconception. So just to re-summarize about that, just keep in mind, Medicare Advantage plan does have its challenges, but they also have a lot of well, lack of a better term, advantages. Lynn, it would be very, very interesting to see if a Medicare Advantage plan would lower your maximum out-of-pocket cost compared to your PDP plan. Because remember, you're paying $154 a month regardless if you use it or not. That's your premium. Medicare Advantage, you're paying $0 per month because it's included. You just have to worry about your copays. Okay, because I can only imagine what kind of copays he's having on his prescriptions, plus the $154. You have to keep all that in mind, plus the $170 he's paying for Medicare. So,
Well,
you know,
let
it
me tell
adds
you,
up.
the medical costs have saved us at tax time because we are
Mhm.
way up there, and yeah, we spend a whole lot
Oh,
of,
your income level? So you're paying more than 170 is what you're saying. Yeah. So those are discussions that we have to have one-on-one. You see how we get into the
yeah. Now,
details,
the
and now
one,
everybody's going,
thing,
I wonder how much you
and I
make.
got your number, but the one other thing that is incredibly important
Mhm.
is, does the doctor that you have chosen and is offering great treatment? If you don't like your doctor, that's fine. But if you do like your doctor and want to keep your doctor, if that doctor is not in the network, then that won't work for us. And the doctors for my husband, who has a very uncommon disease, they will not take Advantage plans. They will only take basic, original Medicare. That's the end of the story. So we did not have a choice, so, but if your doctor accepts it, then that's wonderful, so that's another thing to keep in mind.
So do they take any supplemental plans? Because, you can pay for your supplemental plan. You need to cover that 20% because they will hit you like a Mack truck.
Yeah, and I understand, and it would be so much nicer not to have all these medical bills, but thank the Lord, we can handle them. But I know that, the first half of the year is difficult because of the meds. But I'm like frolicking through the tulips at the second half of the year because all those incredible expenses are not there. And one last thing, and then I'll let somebody else speak. It was offered to me to, I'm always going to, when you have all these medications to pick up, you are at the pharmacy a lot. Okay, they know my car, they know my name, so, and this is
like
pharmacy
Norm at the
awareness.
pharmacy,
Yeah,
like
yeah,
in
it's like,
Cheers,
oh,
Norm.
it's you again. Yes, so, but this month is pharmacy, be thankful or be nice to your pharmacist month. So retired pharmacists included, Pete. So I have a nice month. But I was going to say, I forgot what I was going to say. So, but anyway, I'll think of it later.
This is something else.
Yeah, and I was going somewhere with that, but anyway, it'll come back later, hopefully.
Just a side thing, you said like the pharmacy plans are listed at medicare.gov. Are all the like Advantage plans or supplement plans that qualify, are they also by Travis County? Because they seem to be county specific or.
Yes, they are. You should have gotten in the mail, Medicare and You book. That goes out to every Medicare recipient, everyone that's turning 65. It's called a Medicare and You book. And the back of the book, they'll have all the plans listed per county. Now, Medicare.gov does do that also. It's very simple. You can navigate, just take some time to it. Some people don't want to bother with it, and that's what I do. I show them, let's set up your account. Let me show you how to work it. Let me show you, how to research so that you can see what I see, because it goes down to what's available in your county, and they'll categorize it as, do you want just to see drug plans or do you want to see health plans? And that's what they'll do. Medicare supplement plans won't be listed because those you're paying for. Those have no networks. You're going to pay for those. Those are good options for some individuals also that are, again, like I said, that are traveling. They don't want to deal with networks. They have the funds to pay for a Medicare supplemental plan because the plan G isn't good, only has a $233 deductible. After you pay that deductible, you're 100% covered. I've come across people that have been through cancer treatments, going to the hospital with chronic conditions, and they love the plan because they said, I just pay $233 and that's it. And then I pay my prescription drug plan. The only caveat to that is that they don't stay at the same price. They go up as you age. And I've come across people 78 years old, they're paying $300 a month. And you've got to remember your retirement at that time is fixed unless you have some kind of side hustle. But I always keep those in mind. Let's keep a value of what's important to the client, to the prospect. Great question.
Thank you.
Yeah.
My husband's 90. How much will we be paying?
Okay, so great question. You go through underwriting. They can deny you. Medicare Advantage cannot deny you for pre-existing conditions. They cannot deny you of your financial status. That has nothing to do with that. Medicare supplements, like the Plan G, you go through underwriting. They can deny, or they can hit you with a 90. You're probably looking close to $400 a month at that age. So that's what I always say to individuals, as far as when they're in their 65 or they're in their 60s, their late 60s. I always tell them, do it for as long as you can, but just realize when you start getting to that point of you can't afford it anymore, you have options. Because I come across people that are just like, I'm stuck with this because this is the plan I have. No, you're not. You have options. But the caveat is you do have to go through underwriting. They will check your medical history, and they can deny you or give you a really high premium. That's the only underbelly of Medicare supplemental plans. Any others?
Thank you.
I do have another question. Of course I do. So, okay. If you, my mother lived in Maryland and she had a Kaiser Permanente Medicare Advantage plan. I guess it was Advantage, but it was through Kaiser Permanente. When she went to visit her family in California, perfect, because Kaiser's over there. She moved down to Texas. Kaiser Permanente is not in Texas. So I didn't realize at the time that can somebody who's in an Advantage plan and is traveling to a state that does not have that particular plan, can they switch their Medicare to the original while they're there? Or and then switch back when they go home? Or if they move, like she ended up moving to Texas, should I have just switched her from Kaiser to original?
Great question. I like that question. Okay, so you have two different scenarios. If you have Medicare Advantage does allow, because it's all about Medicare. Medicare is the one that holds all the puppet strings. You do have a time limit of keeping your Medicare Advantage plan. Like, say for instance, you're from California, you're here in Texas, but you're here to take care of the grandkids. You're not a permanent resident. They will allow you to have coverage here on emergency basis only. You can't go see a primary. You can't go see a specialist just because you want to, or for a follow-up. It doesn't work that way. You have coverage if it's emergency basis only. So if you're in a hospital, your plan will work. Your plan will cover you. Okay. Doesn't matter what kind of plan it is. If you're traveling and you're at a different state out of the coverage area, you do have temporary coverage. The second portion to that question was that she ended up moving here. Well, if you take residence here, the first thing you need to do, like anybody knows, is you need to contact Social Security to change your residence. Once you do that, you get a local Medicare Advantage plan, because they are not nationwide. They're only nationwide coverage on emergency only. You do have specific plans in specific counties and zip codes. She will need to get a local plan. Remember what I was saying in the presentation, that you do have special election periods. That's the special election period. You moved out of a coverage service plan area. So she doesn't have to wait for an enrollment period. She can enroll and start the next month. So anytime that you're going to enroll, it starts the beginning of the first day of the next month. So two scenarios to that, like you presented. She was just here visiting. She does have coverage in emergency basis only. If she takes residence here and moves here, she needs to contact Social Security, change her address, then Medicare will allow her to change her Medicare Advantage here with no enrollment period, with no annual enrollment or open enrollment.
All right, thank you.
Yeah. Any other questions?
Well, I have a question, just, because they are local and they'll take it emergency only. And I know Medicare is a little more flexible on that, because it's kind of nationwide. So if it's emergency only, do you need travel insurance? I know, like, if you go international, you should get some backup health thing short term, because only Medicare, even Medicare ends at the border. But these advantage plans, like you said, if you go for a couple of months to take care of a grandkids or whatever, if you're just emergency only, you know what I mean? It's just, as you get older, you have the maintenance stuff. Is there something like a travel plan, or is there, I'm just curious. I didn't know.
Okay, so you do have travel coverage with the Medicare Advantage plans worldwide. It's a limit. I believe the limit is $50,000.
Okay.
So you do have that option with with Medical Advantage, and also Original Medicare does help with that. I think theirs is at 20,000. So there's limits. So keep in mind, temporary. Medicare sees temporary as you're not living here and your doctors are not here. Okay, so keep that in mind. That's why you have to consider the emergency only option, because they understand things happen. You have to go to a hospital. You have to go see a doctor because of a certain emergency. They'll cover that. The Medicare Advantage plan will cover that. Even though it's from California or North Dakota, it will cover here.
Yeah.
Okay. But that's why you always have that temporary aspect. Temporary can be 3 months. They're changing that. I believe they're going to increase that to 6 months for 2023. Medicare is. But right now, it's only 90 days that they'll have a temporary coverage. But I do believe they're changing that to 6 months for next year, which I'm happy to hear. Does it help some individuals? Yeah, I guess. If you're going to live here for 6 months, it's a certain situation. But again, if you change your residence, you need to change your plan. They give you 90 days to change your plan when you take up residence, because your other plan will discontinue you. They will terminate your coverage after 90 days because they'll see that your residence is a different area. Okay.
So there are snowbirds, people who live half time in Texas when it's nice, and then half time in another state when the winter months come. What is that? How does that is impacted by Medicare, Medicaid if you reside in 2 different places half of the year?
That's where a Medicare supplemental plan comes in. If you have snowbirds, again, what I was saying is traveling, you have options. Don't take a Medicare Advantage plan. You need to take a Medicare supplemental plan and pay for it month after month. See the options that you have? You take a Medicare supplemental plan, it's accepted nationwide with no networks, but you're paying for that month after month, and you have to pay for your prescription drug plan. Medicare Advantage plan doesn't work that way. They only are temporary. They give you a lot of benefits. They include dental, vision, hearing, over-the-counter credits where they give you. Some plans even give you a prepaid credit card to spend on groceries, utilities. They give you a lot of benefits because they know they're being subsidized by Medicare, but you have to deal with a network. You're local. They're only nationwide emergency. So you have pros and cons to both aspects. If you're a snowbird, don't get a Medicare Advantage plan. You need a Medicare supplemental. Because let's be frank, if you're a snowbird, you can afford a Medicare supplemental. Because being a snowbird, you have a lot of extra costs in travel, in expenses of setting up at a different place. That's the advantages of certain situations.
So what about in a situation where somebody doesn't have enough money to pay monthly fees for Medicare? Can they choose not to have Medicare at all? Like if you choose right now not to have insurance, you just don't have insurance if you're under the age of 65. If you're over the age of 65 and you choose not to have Medicare, can you do that without penalties?
No, you can have Medicare Part A only, which is only hospitals that has that 1460 deductible that never stops. It always renews every 60 days. You can have that option. I come very far and few between individuals that have Part A only, but that's their right. Once you want that Part B, you get hit with a 10% annual penalty for every year you did not have Part B. You got to understand, we have programs just like Affordable Care Act has caveats to where everybody has to share the cost of other people's insurance. You heard that term. Well, Medicare has that because they're not going to give people that have been paying their Part B this whole time, and then somebody that just 20 years later says, now I need the Part B without penalty. They're not going to do that. So yes, you can have Medicare Part A only and not take anything out of your Social Security. And, God bless you if you have perfect health, but we all know that's not going to happen. I mean, with all the additive and preservatives that we're exposed to every day and the chemicals that we're exposed to every day, it is to your advantage to have some kind of health insurance. If it's just original Medicare, that's what you're looking at is Part A and Part B with never ending deductibles, paying 164 next year. And then your prescription drug plan that you're paying for. Even though you might not take prescriptions, you want to avoid those penalties. Those are the loopholes that I talk about that I wish weren't there, but they are. And we have to deal with them. Great question.
I have another question, but
Yes, ma'am.
please, somebody else, Millie, Karina, Crescencia, anybody else have anything else to ask? Because I do.
I'm not intelligent enough to even know what to ask.
Yeah, yeah, of course you are.
Well,
I am a little confused with the difference between the supplemental plan versus the Advantage plan. I'm still, I don't get the difference.
Okay. Did you, because I don't recognize, were you here on the beginning of the presentation?
I was. So those
Okay.
two charts, the first one and or the second one, those were the differences?
Yeah, well, okay. So just to answer your question, the differences between a Medicare supplemental plan is the ones with the letters. Plan N, Plan G, Plan F is no longer available for new 65-year-olds. They sunsetted that plan, which I hate because that plan was the best. You had no deductibles, no co-insurances. So, and let's put that information in there. So that Plan F, if anybody can afford it and wants it, you can get it if you were 65 before January 2020. January 2020 was the cutoff for Plan F. They sunsetted it. So anybody turning 65 after January 2020, you can no longer get the Plan F. However, like I stated before, it goes through underwriting. They will check your pre-existing conditions. They will check your if you have another Medicare supplemental plan and you're just looking for a cheaper rate, they all communicate. And they will base that on they're either going to deny you or what level of premium they're going to be. Now, to go to your original question, Ms. Hernandez, the difference between a Medicare supplemental plan is a client is paying for that. They're paying for their monthly premium and their Medicare Part B each month. They do not include all the bells and whistles of dental, vision, hearing, or prescriptions. They have to get a separate prescription plan. The other side is Medicare Advantage, which is also known as Part C. Part C, Medicare Advantage, includes your prescription, includes dental, vision, hearing, and other little bells and whistles. And a lot of those plans have zero premium per month. You don't pay for them because they're subsidized. However, there are some plans that you do pay for on Medicare Advantage, depending on your area. And the reason why I say that is because when you're living in a rural area, there's not a lot of plans. Medicare Advantage knows this because you have to travel quite a bit for doctors or what have you. They're going to make you pay for that. They'll put like $49 a month or $38 a month premium, and that's all you got. That's all the choices you have. When you live closer to a city, you have more options because there's more doctors, there's more hospitals. You're not into what they call a medical desert. You know, if you live way out in the middle of nowhere, and you don't have a lot of options for hospitals and doctors, you can get a Medicare Advantage plan to travel to these doctors, but you're going to pay for it. It just depends on the area and situation. Hopefully I understand. I know I could get chatty Cathy, but there's so much information and I'm just trying to hit on every little scenario. So the difference is, one you pay for, the other one is inclusive with all these benefits that you not necessarily pay for. It's zero premium. Does that answer your question, Mr. Hernandez, or do you want?
So what's the benefit of the supplemental plan if it doesn't cover the other, like the dental and the vision and the hearing?
Let's go back to the snowbird scenario. Traveling. If you're a snowbird and you go to Florida, which my heart goes out to those people, that's really rough. You go to Florida for 6 months out of the year, and you want to come back to you live in North Dakota. I see this all the time. As a matter of fact, let's say here in the Gulf Coast, I've met some people that live in Iowa, North Dakota, and they come down here for 6-7 months out of the year. A Medicare supplemental plan is nationwide, no networks. You can go to any doctor that takes Medicare, okay? And they're paying for that. So when you're a snowbird, you're going to have the funds to pay for a medical plan. And those are really good for them. Medicare Advantage plans, they're not nationwide, only emergency only. They're local. You have to stay local with your local doctors on a Medicare Advantage plan. Your primary, your specialist, that's what you're looking at. On a Medicare supplemental plan, you go anywhere and see any doctor, any specialist, low deductible, but you're paying for it month in, month out, whether you use it or not.
Much.
Sorry?
Okay. Yeah, I said got it. Thank you so much.
Okay, what I often hear is that supplemental will pay for the 20% that you pay if you have original Medicare. That's how I've seen it mentioned. I don't know if it pays for the entire 20% but then you're still paying something. So whether it's a 20%, which may or may not be bigger than the supplemental monthly premium, I mean, it's kind of like.
Great question. Let me expand on that. That's a great question. Let me expand on that. Remember what I said about the Plan G as in good. That's the one that is very popular right now because it's the highest. It's the best plan. You can no longer get Plan F or it's higher cost. So Plan G only has a $233 deductible. When you spend $233 on your medical, it's 100%. You pay nothing else. It's 100%. The only thing you're paying for is your Part B per month and your Plan G per month premiums, along with your prescription drug costs plan per month. You're paying premiums per month, but it's a great plan for some individuals that can afford it and that can handle it. That's the lowest deductible you will ever experience is $233. You can do that in one doctor's office visit. I've met individuals that have told me they had hundreds of thousands of dollars in medical bills. They paid $233. Sounds great, but you got to remember, does it fit your budget? Does it fit your lifestyle? Does it give you value? Because again, Medicare supplemental plans are meat and potatoes. They're only for your hospitals and your doctors. They don't give you any extra benefits and they don't cover prescriptions. So is it the right plan for you? That's where we have to review and see. But yes, ma'am, the only out-of-pocket cost you have is your monthly premium and $233 deductible. Everything else, 100% covered.
Okay, and yeah, okay. And I did have one other question. Oh my gosh, I'm such a chatterbox. Okay, so I back in the day during the Jurassic period, I worked, okay, in retail. And I got a letter from Social Security. Every so often, they give me an update and they tell me that in order for me to get any Social Security benefits, including Medicare benefits, I need to work 4 more quarters or another year. I had never heard of that. So I thought Medicare was for everybody. I did not realize, like, I chose to be a stay-at-home mom, you know, and that's why I didn't go back to work, because I wanted to take care of my kids myself. And so I don't get Medicare unless I work for 4 more quarters.
That or you do a buy-in. They have an option to do a buy-in. So let's talk about the qualifications for Medicare. 40 quarters basically equals out to 10 years in your life of working. Doesn't matter if it's 1 job, 20 jobs, just as long as it adds up to 10 years of paying Social Security Medicare, because everybody's paying in their paycheck Social Security Medicare.
Right.
So given that fact, that's how you qualify, because you got to remember, we do have individuals like your certain, situation that just stay-at-home mom, or you're an immigrant, you come here, you become a citizen, and you don't work your 10 years because you're here later on in life or what have you. There's different situations. So they do have an option to buy in. To buy in your Part A, you're going to pay for your Part B, but you're to buy into your Part A. That could be a couple of $1,000s to buy in. And then they'll allow you to get Medicare, but you're going to pay your monthly $170 after that. So great question. Yes, you do have to have 40 quarters, or like I say, 10 years of working, paying your payroll tax, basically.
That is horrifying, because I mean, there are many of us who chose to raise our children, are stay-at-home moms, and now we get penalized for that choice.
It's unfortunate. I do come across people that are 65 and they are short a couple of quarters and they say, I just got to take a part-time job. Why do you think you see a lot of individuals that are Walmart greeters? They're just trying to get their quarters.
Oh my gosh. Okay, so I'm going to go. Is anybody hiring? I turn 65 next August. You know, I need like an income. Yes.
Holidays are coming up. You know, a lot of places are hiring.
No, I
Yep,
know.
you got that.
Oh my goodness. So, okay. Yeah. Okay. So I have to think very quickly, because if I don't get a job and work my 4 quarters and I'm already late, then I have the 3 months after my birthday next year to enroll. Otherwise I get a penalty for joining late.
And does
Right.
it have to be a full-time job, or can it be a part-time job, or?
I don't know. Well, it said 4
Yeah,
quarters.
it's a what I understand. It could be a part-time job, just as long as you're making the
Paying into it.
quarters and you're paying into Social Security Medicare.
So let me
Oh.
ask this, like, my sister's never worked a day in her life. You know, she got married out of high school. Her husband had a business and she was a stay-at-home mom, and now she's taking care of her grandchild. So if something happens to him, she will have no coverage would she get his Medicare?
No, Medicare is individual.
She'll get
They
his
they do have a certain
but not.
they do have special they do have certain circumstances, qualifications. That's a really convoluted area, because I've come across scenarios like that, and they were able to get their Medicare, but they had to do a buy-in. Again, it's that buy-in portion again,
Oh,
where they have to buy
realize
their
that.
Medicare.
See,
Yeah,
I have a question.
good.
May I ask a question?
Please.
Okay, I graduated the week before my son was born from nursing. I never worked as a nurse. And so and my husband has his Social Security and stuff. And I did work for 8 years in his practice. But the accountant said he shouldn't be paying me because it wasn't going to be beneficial or whatever. Or that what's going to happen to me if when my husband passes away? Don't I still get Social Security and Medicare?
Okay, so the question is about Social Security or is it about Medicare? Because
I
Social
think
Security,
Oh,
not to
I think I
blend the,
got confused. And
yeah,
I was thinking
not to
Social
blend the
Security.
lines. Social Security only handles you getting enrolled into your Medicare and taking it out of your Social Security check to pay for Medicare. Your question sounds more like a Social Security question, which I'm not an expert at.
right.
So I don't want to mislead anybody on that and just give you, hearsay, oh, this is what I heard. Those are great questions that you need to ask Social Security, but dealing with your Medicare, they only handle making sure that they take it out of your Social Security check, or they bill you directly. Medicare will bill you directly if you're still working and not taking your Social Security benefits. You have that option too, but they will bill you directly.
Millie, it kind of sounds like if you did not get paid while you were working, that you were not contributing into Social Security funds, and therefore you would not be eligible. You and I are in the same boat.
Right.
Would not be. That is so unfair. I'm
But
gonna.
you
Well, no,
would-
I mean,
you would get your husband's Social Security
Yeah.
benefit.
But they take half of that away. That's why half the widows are in poverty, because they take their husband's Social Security away from them.
Do they? I thought you got it.
no,
You get
have a
only a
choice.
portion of it. It becomes less than what my husband's getting now. It's like 3,000 a month. Okay, but when he passes away, I will not be getting that 3,000 that he was getting. I will be getting only a small portion of that.
Did you hear that from Social Security or you heard that from somebody? Because this is the way I understand Social Security. And please take this as just information that I've heard from my mom. You have a choice. When your spouse passes away, you either stay with yours or you take theirs. And my mom is planning to take my dad's because he gets it higher. Okay, that's the basic of understanding that I have.
That's what I understood too.
Now to go
Oh.
back to your question about being paid in cash and thinking that you're working but you're being paid in cash, that's the portion that I heard Lynn was talking about. Yeah, you won't qualify for Medicare. You have to be paying your taxes through your Medicare tax as far as your Social Security tax. Okay, so if you're paid in cash, great, but you're not getting qualified for Medicare later on in life.
Yeah,
I come across
no,
that with a lot of individuals that are undocumented. They come up to me and they say, I'm trying to get Medicare, but all my life I've been paid cash. And I go, you haven't paid taxes,
Yeah.
so you're not going to get Medicare.
Okay, I think we're gonna have to move on to our sharing time. So please, I will email, I don't know if you're able to put your contact information on the chat right now, Jean, but I will email his information to everybody in the next few days, okay? Do you want to, Jean, just give us your phone number that we can call you? Because sometimes it takes me a couple days to get to the email to put it together sensibly.
oh, there.
Yeah, I'm putting it in the chat right now. My
Oh,
phone
wonderful.
number. I'm
Thank
going to put in
you.
my email.
Oh, it
Just
just
look in the chat.
disappeared.
It's 512, yeah, 940. Yeah, let me open the chat here.
Mhm.
Okay, so it's Jean Rodriguez at fcgins.com.
Well, what was the rest of the phone number?
It is
No.
512-940-2713.
2713, okay.
Okay, so let me put this down over here. I know I have it, but I can't
And
walk.
just, and just to confirm, everybody on the Zoom, on the chat is from Texas, correct?
Yep.
Yes.
Yeah,
Okay.
we live here.
Yeah, because I did another Zoom and half the people were from Arkansas and I go, whoa, wait a minute. I go, I can only talk
Oh.
Texas.
Oh,
No, you mean that we're living in Texas, right?
Yes, yes,
Yes.
ma'am.
Oh, okay, because originally I'm from Buffalo, New York.
all right. Yeah, no, it's just where you
Oh.
are right now. So you
Okay,
are okay.
don't scare me.
Okay.
It was a pleasure talking with you all. I do have to go because I have an appointment at 11:30 and it's 11:23 right now.
Oh, my
Oh, boy.
goodness. Okay, well, thank you so much.
Not a
again,
problem. Thank you so much.
Yeah,
I
all right.
appreciate it.
And all the best to you. Thank you.
Thank you.
Bye-bye.
God
See
bless
y'all.
you. Have a
Bye.
good day.
You too. God
Thank
bless
you.
y'all.
Bye.
Bye-bye.
Stuff.
Yeah, it is. It's wild and crazy. So, okay.